Good morning, everyone. Thank you for coming. We're really excited and appreciative to have Delia here today from the Social Security Administration.
I'm sorry, we can't hear you. We said, should I move you up?
Yeah.
Move up?
So, and PAC TV is here today filming as well. So I'm going to hand it off to Delia, and we'll be available at the end for questions or things like that. So if you want to hold on to your questions to the end, that'd be great. So thank you.
Thank you, Alexandra. Good morning, everyone. So wonderful to see you. So great to be out and not having to do this via Zoom. Right? So exciting to be out and see people again and do what I love to do. Thank you for coming out today. Thank you for PAC TV for being here to help amplify the message and spread it out to the folks that maybe couldn't be here today. As Alex said, if you don't mind, only because of filming and we don't want to share personal information during the broadcast, at the end when we finish taping, then you can ask whatever you want. We'll open up for a good Q&A session. But I wanted to talk about some updates since the last time you may have been connected or talked to someone from Social Security. Some things that are new, some things that have changed that I feel you should all be aware of. And hopefully then you can take this information and share it with your friends, your family, and so forth. Okay? So something that's new that some of you may not be aware of, especially if you're already collecting Social Security and maybe been collecting for a while, is that we now have a new question on our applications for Social Security benefits where we ask the applicant to tell us whom they would trust to manage their Social Security benefits if they should become unable to manage their own benefits, unable to manage their finances because of an illness, right? Some sort of incapacity that would impair their ability to manage their finances. We call those people representative payees. Some of you may be familiar with that term. That is the person that is trusted, that is designated by Social Security to manage the benefits for someone who's receiving Social Security. Who has a representative payee? Well, it can be someone who's on Social Security or SSI that may have a cognitive impairment, right? Maybe from birth or maybe by an illness, maybe a stroke or something that affected their ability to manage their finances in their best interest. So in many instances, that would only come about post-eligibility, after someone's been receiving benefits. Maybe a child comes to the office and says, my mom's becoming very forgetful, or excuse me, my father has dementia and now I have to pay all the bills, I have to take care of all his finances. And then they apply to become the representative payee, okay? Meaning we will send the check in that person's name for the use of the beneficiary. They have to account to us how they managed and how they used those funds, if they saved any of those funds, right? We do check, we do want to make sure that those monies are being used wisely for the best care and intent of the beneficiary. But now we give beneficiaries or applicants, when they apply, the opportunity to tell us who they trust, if they should need a representative payee, right? We're not all going to need a rep payee, but we may. So when we're deciding, and if we have a few people or even an organization that comes forward and says they want to be your rep payee, it would be helpful to us to appoint someone that we know you trust and that you selected, and that you said, well, if there was a need, I would trust this person. And you would give us that contact information, and we keep it in our files. Of course, now our files are all electronic. So if you didn't do that because maybe you're already receiving benefits and that question wasn't on your application at the time, you can still do that if you wish. You don't have to, but you can if you wish. You can go onto our website and through your My Social Security account, which we're going to talk about a little bit more in depth today. you have the opportunity to enter that information on your account. And if that's not possible for you, you can always contact your local office. And you can also designate your payee that way, and we can annotate our records. But I also wanted to say that we're very happy to announce that, if you don't already know, we finally opened our doors to the public in April. Right, so exciting. During the pandemic, we were only open for appointment only, and it was only for what we called dire need appointments. And those were for services that we couldn't otherwise conduct for you over the phone, or maybe it was something that couldn't be done online. Then we would set up an appointment, a specific day and time where you could come in and speak to a representative. And again, those were more like emergency type situations, things that we couldn't do over the phone. Maybe something that where we had to see documents, right? We had to see a passport or immigration documents or things like that. But I'm happy to say that as of April 7th, our offices opened again. You can come in without an appointment now, although an appointment is preferred to help minimize your wait, but you don't have to. You also have the option of calling us, and you also have the option of contacting us through our 1-800 number. And if you don't have that, our 1-800 number is available Monday through Friday, 8 a.m. through 7 p.m. At 1-800-772-1213. And of course, our website, which allows you to conduct so much business with us. Alex is nodding her head. She knows, she's been on there, she knows. From applying for retirement benefits, Medicare, disability, even SSI now, can be done on ssa.gov. That's another easy, safe, convenient option instead of being on hold for a long time or going to an office and wait for a long time. And again, COVID is still around, so if you decide to come in, just do remember, we do require a mask. If you come into the office, you will be required to wear a mask, okay? But I did want to make that announcement because that is very exciting for those of you that may not have already heard. So My Social Security. How many of you have a My Social Security account? All right, a few of you. So that's homework today. For those of you who do not have a My Social Security account, and you are online, you use the internet, try to set up your My Social Security account. Like your online banking, it allows you to manage, control your benefits. There is so much you can do, especially when you're a beneficiary. Simple things like changing an address, updating a phone number, replacing a Medicare card if you lost it. We just added, not too long ago, replacing a Social Security card, right? Some of you are trying to get that real ID, and one of the documents that the registry will ask if you don't have a W-2 form is your Social Security card, and they do not accept a laminated one. It would have to be the paper original form card. So if you need one, you can save yourself a trip to the office. Once you create your My Social Security account, that's one of the many things you can do is replace your card, and you'll get it in the mail within 7 to 10 days, just like if you visited the office. For folks, maybe some of your kids and family members that are thinking about retirement, planning for retirement, and they're curious about how much will I receive? Or, gee, what would the benefit amount be if I retire at 62 versus 66 or 67, depending upon what their full retirement age is. For, again, non-beneficiaries like me, like Alex and Chris, right, that are dreaming about retirement, we can use our My Social Security account to use the benefit estimators, right? We can plug in an age, and then boom, in a few seconds, we're going to get an estimate without having to go to the office and sit and wait. That's a nice, quick, easy way to get that information. Another great tool for non-beneficiaries, right? People that are still working but thinking about receiving benefits. We no longer mail out the statement. Remember the statement we used to mail out every year, right? It used to arrive around your birthday. It would chronicle all your earnings, right? And we always encourage everyone, every year you should look at that, review it, make sure it's correct, because we base your benefits based on those earnings, right? We look at a lifetime of earnings to determine your Social Security benefit. So it's very important that everyone review it at least once a year. Well, this is the way to do that, right? This is the way to do that. So we have life expectancy calculators, calculations for folks that are thinking about spousal benefits and how much they may qualify as a spouse or even widow's benefits, the different offsets that are applicable for folks that work for municipalities or work for the Commonwealth of Massachusetts that'll be affected by those provisions known as the windfall elimination provision or government pension offset. We even have calculators online for that. So again, great planning tools that make it simple and easy for folks to plan for their future benefits. I wanted to quickly share with you the new numbers for 2022, the earnings limits for folks that are collecting retirement benefits and may be working. So these amounts change every year, right? They increase every year. And for this year, for a retiree that is under full retirement age, they can earn $19,560. This doesn't include pensions, annuities, or anything like that. This is W-2 earnings, or if someone is self-employed, their net from self-employment. So that's the earnings cap for this year for folks that are under full retirement age. For someone who will be full retirement age this year, look at how much more they can earn, $51,960. And then from the month you reach full retirement age, from that month forward, there's no limit. You can earn whatever you want. However, maybe you're thinking, well, what happens if someone goes over that amount? What if they exceed those caps? Well, when you're under full retirement age, if you exceed that cap of $19,560, when our friends from the IRS let us know what you actually earned, the payback is $1 for every 2 that you earned in excess. If it occurred in a year that you reached full retirement age and you exceeded in the months before reaching full retirement age, if you exceeded that $51,960 figure, the payback is $1 for every 3. Okay? Just important FYI for those of you that are retirees and still working. Okay? Again, if you think it's July and you look at your year-to-date pay stub and you think, oops, I'm creeping up to that amount, all you need to do is give us a call and say, I didn't plan on it, but I think I'm going to exceed that cap for this year. I think I'm going to earn 22 or 23, whatever you think it is, so that we can, based on what you estimate, hold a check or 2, depending upon what you estimate, to avoid you getting that letter that you will receive once the IRS tells us what you actually earned, and then have to receive that notice that you'll have to pay us back. So that can be avoided. So again, if you're working, if you're under full retirement age, or if it's the year that you're going to attain full retirement age, just watch the year to date on your pay stub, and if you think you're creeping up to that amount, just give us a call to change it, okay? And that avoids that overpayment situation. So for Medicare, this year, it did go up a little bit, right? The Medicare Part B premium, it did go up to $170.10, right? And for most of our beneficiaries that are receiving monthly checks, that amount is deducted, right, every month from your check. Some folks that maybe just signed up for Medicare, maybe they're putting off, they're delaying collecting Social Security because maybe they want to receive a full benefit or a greater benefit, right, by putting it off. Those folks get billed quarterly for Medicare. But some folks do pay more. It's not, that's the standard amount, but some folks do pay more for Part B and even for Part D of Medicare. Part D, of course, being the prescription coverage piece of Medicare. So some folks in a higher income bracket will pay a little bit more, pay a little extra assessment on top of that standard premium. So for this year, for individuals with modified adjusted gross income in excess of $91,000, we'll pay an extra $68 and an extra $12.40 on their Part D premium. So for couples that have income, modified adjusted gross income, you look at that line on your 1040, when you file your income taxes. So for couples with modified adjusted gross income in excess of $182,000, they each would pay an additional $68 for the Part B and an additional $12.40 for the Part D, right? Because Medicare is individual. We don't have family plans for Medicare. This information can all be accessed on our website. It's all there. But if you contact Alex, if you want a copy of this presentation later, she'd be happy to forward it to you. So Medicare.gov, open enrollment is coming up, right? It's right around the corner. My friend here is nodding his head because he's very involved with that. So Medicare.gov has lots of information if you're curious about shopping around for different Part D plans, looking at Part C plans, or different MedX plans that are available to you. Of course, Social Security doesn't enroll you in those plans because these are all private plans. So Medicare.gov is where you could find information about that. Or of course, call your friendly Shine counselor that has a wealth of information and can really help guide you in the right direction based on your individual needs. I always say to folks, be careful and cautious. Don't go by what your neighbor says is the best plan. It may not cover the drugs that you take. My parents are on Medicare, my mom's on one plan, and my dad's on a different one because they each take a different set of medications. So what works for my mom for a Part D plan wouldn't work for my dad. So again, we have to be careful, do our homework. If you do it yourself, you can go on Medicare.gov. There's a link there for my prescription plan finder. You plug in all your medication, including the dosage, and hopefully you're taking generics and not the retail, because that'll allow you to be able to sign up for a more affordable Part D plan. But if this is too confusing for you and you're not sure, you have extra questions that you're not able to find here, again, call your Shine counselor. They're a great resource. But when you go on Medicare.gov, and remember, any government website, make sure you're on .gov, socialsecurity.gov, not .com, not .net. That's not us. You'll be on a website that might be charging you for information, right? And all our information is free, same as Medicare's. So remember, irs.gov, socialsecurity.gov, medicare.gov. So again, if you're thinking about open enrollment and making changes to your insurance as far as Medicare, remember, find health and drug plans from medicare.gov. Great, helpful resource to help you with that. So we offer an assistance program with Part D costs called the Extra Help Program. The Shine counselors call it the LIS program, or Low Income Subsidy Program. Some folks won't pay a premium if they qualify, depending upon their income bracket and their resources. But folks that qualify for this can save up to $5,100 a year in out-of-pocket expenses. They'll pay the lowest copays at the pharmacy and sometimes no deductible if they qualify. The income and resource guidelines are much more generous than for Mass Health, right? But for some folks that might qualify for Mass Health or Medicaid, right, that aren't even aware, when you apply for this Extra Help Program, which this application is available on socialsecurity.gov, we will send this information to the state so that they can screen you and see if you qualify for any of the Medicare savings programs that can help you not only with Part D, because that's what we're looking for, but they might qualify, you might qualify through the state for help with your Part B premium, right? Depending upon your income and your assets. So do be aware, if you say yes to us sharing your information with the state, You could receive extra forms in the mail. And again, it's all part of the process to see if perhaps you qualify for any assistance through the Commonwealth, through the state of Massachusetts. But it's a great program. If you qualify, it's for a whole year, and we do review your eligibility annually. So just do know that if you qualify, the following year you will get a questionnaire in the mail, just looking to see if there have been any changes, right, in your income, whether you're still married or separated, or any changes, again, that would change your eligibility. Just remember, please do complete it and send it back to us as soon as possible so that you don't have any gaps in your eligibility. Because again, this is a big help for people that spend a lot of money on their prescriptions, right? That hit those donut holes, as you've heard, right? Which thankfully those gaps are closing very shortly. But in the meantime, again, very important, if you qualify for this program, just make sure you complete those eligibility forms and send them back to us right away so that hopefully we can continue your eligibility and you don't have any gaps or termination because you didn't send it back to us. Okay, again, that's the Medicare website. So much information about what Medicare covers, what it doesn't cover, because again, we determine your eligibility for Medicare. We sign you up for Part A, we sign you up for Part B. But aside from that, if you have questions about medical equipment or any medical service and you're curious about will Medicare cover it, Social Security wouldn't be able to answer those questions. You would have to call Medicare, right, at 1-800-MEDICARE, or go to medicare.gov to find that information about coverage. So how to apply for benefits with us. As I mentioned earlier, you have the option of going to our offices now, but we also have the very easy, safe, and convenient option of going to ssa.gov for retirement, disability, SSI, the Extra Help Program, Medicare only, all available on our website. The only application that's not yet available on there is survivor benefits. So if you should lose a spouse, that application yet is not available on our website. So you would need to contact us by phone or visit so that we can determine if you qualify for survivor benefits, okay? You can call us at the 1-800 number to schedule an appointment. And again, that number is available Monday through Friday, 8 a.m. to 7 p.m. Okay, so now I wanted to talk a little bit about fraud, a little bit about scams and identity theft. How many of you have ever received those calls saying that your Social Security number was compromised and you need to call them back right away? How many? They even get your cell numbers now, right? They're even sending texts. Look at this. Over 5.7 million reports of fraud, identity theft, and other reports to the Federal Trade Commission in 2021. 1 in 5 people lost money in imposter scams, totaling $2.331 million. That's outrageous. Be careful. Guard your Social Security number, your card, with your life. Do not give that number out unless you know who you are speaking to, okay? I hope you're not carrying your card in your wallet. It should be in a safe place, just like your other documents, just like your life insurance policy and passport, right? We don't give that number out unless we know who we're speaking to and we understand the purpose of why they need that number. Be careful for these imposters that call your house threatening you. We do call people. I know one of my friends received that call and said, oh, this is a scam, right? Social Security never calls you. That's not true. We do call you. If you qualify for benefits, if you're on SSI, we contact you because we have to review your eligibility every year. If you qualify for that Extra Help Program with Medicare Part D, we try to resolve your application, reviewing your eligibility. We try to call you to resolve it quickly. If you don't pick up, we'll send you a letter asking you to call us. So we do call you if we have business with you. Difference is We're not threatening you. We're not asking you for money. We're not demanding a wire transfer or gift cards like these folks are. We're not threatening you that the FBI is going to come to your house. My dad received that call and was terrified. He said, "Are you sure that's not legit? They said the FBI would come." And that's how people, out of fear, react and pick up and respond to these people out of fear. Social Security, a Medicare rep, any government agency is never going to threaten you that way. Okay, so be very careful. I always tell my family members, if you don't recognize that number, don't even pick it up. It's not your kid's name coming up on the caller ID. Don't even pick it up. If it's important, if it's official, they're going to send you a letter. And even so, with some letters you have to be careful. With emails, sometimes you have to be careful. A lot of them are very tricky. They'll send you emails that look official. So you have to be so careful, okay? This is just a few examples of the impact of identity theft. Why would they want your social security number, you're thinking? Well, these people might have bad credit, and they want to establish good credit with your number, right? They're going to open up credit cards with your name, with your social security number. They may have outstanding debt with the utility company, and now they're going to use your nice clean record to open up utility accounts. The list goes on. Irs scams, they have your number, they can file income taxes to get your refund, right? That's why the IRS tells us we should file our income taxes right away before maybe a fraudster that has our information tries to do it. They could apply for employment using your number. Again, another reason why everyone should have a My Social Security account, and they should review their statement every year, review those earnings, make sure there's nothing suspicious or incorrect posted there. And again, if you see that, if you identify that, contact us so that we can take action, okay? So many things they can do. So again, please be careful, guard your Social Security number, guard your Medicare number as well. During the pandemic, we learned of scams that and fraud that even involved people impersonating Medicare representatives and saying that they could help get you on the list to get your vaccine if you provided them with your Medicare number. All right? Medicare never calls. Medicare never calls. We call. Medicare never calls. So again, be careful with your Medicare number too. Do not give that out. And you should only have that in your wallet if you're going to the doctor or if you're going to see a clinician and you need to present your card. Other than that, that shouldn't be in your wallet either. And we know now that Medicare doesn't even contain your Social Security number, right? Now the new form of the Medicare card is a combination of numbers and letters. Again, why? To protect your identity, okay? So what to do if you've been scammed? What to do if you identify a fraud situation? You can report that to the Federal Trade Commission, and you can do that by going to identitytheft.gov. You can choose to file a report also with your local police department, depending upon the nature and the severity of the situation. Okay. There's so much free help from identitytheft.gov. They will provide a step-by-step plan for you to help you recover whatever information or perhaps even money that's been lost. There's an identity theft affidavit that you can review and update at any time. Customized pre-fill letters to send to credit bureaus to put a flag, right, or a freeze so that the credit card companies know that your information's been compromised. Someone has some of your information, so this way they'll put a flag, and so these folks won't be able to open up new credit cards with your information. They can also provide information and advice on what to do if your information has been breached, some of your data has been breached. So again, the 3 major credit card companies and their phone numbers and how to reach them, okay? By either phone or by email for Equifax, for Experian, and TransUnion. So Equifax.
Way to get a copy of that.
Oh, absolutely. All this information we'll be able to share at the end of the presentation, okay? 'Cause I don't expect you all to remember this. We'll definitely make this available, okay? So again, we do contact citizens. We do contact beneficiaries by phone. If we have business with you, right? If we need to verify some information, if we need a document from you because we're working on an eligibility, on an application for SSI or for Medicare or for the Extra Help program. So there are instances where we will contact you by phone, okay? The difference is we will never threaten you, okay? We're not going to ask for money like these fraudsters are. So be cautious, be vigilant, and protect your information. Okay. There's also that do not call number, right? That you can try to use that as another defense mechanism to help minimize those calls that you may receive. The number is on the screen as well as the website. Of course, again, if you suspect you've been a victim of fraud or any type of financial exploitation, report it to the Office of Inspector General at oig.ssa.gov. And on that website, there's so much information about what to do, what steps to take, depending upon what happened, okay? Again, and the number for the Federal Trade Commission is on the screen here. If there are any issues with tax issues, again, irs.gov, in a situation where someone had your information filed for your income tax refund, again, you want to go to irs.gov/identity theft, or of course you can call IRS at 1-800-908-4490. Again, we're not trying to scare anyone. You all know this is out there. We all know that fraud and scams have always existed. Except it just seems to be on the rise right now. They're very tech savvy, these folks. They know what to say. They're very manipulative, and they have tricked people into divulging information. So again, we just want you to be armed with the information to protect yourself so that you don't become a victim. Okay? Again, so this is what our website looks like these days, right? With little buttons that you can click depending upon the benefit you wish to apply for or the benefit even that you want information about, right? Retirement, disability. We even have information for employers. The tab to create a My Social Security account is right there. The retirement estimator, which you can get there from that tab, or of course, if you're in your My Social Security account, you can get into the estimator page that way as well. We have an FAQ, or frequently asked questions page, with very common number of questions that people have about benefits, ranging from retirement to disability to spousal benefits to children's benefits. That again, rather than maybe be on hold or visit an office, you might find the answer right there. All of our publications also available on that website that you can download and view on your tablet, on your computer, even on your phone. So, My Social Security, this is a wonderful tool. I encourage everyone to have one if they don't already. When you're setting up an account now, the new way is either by going into login.gov or ID Me, if you have ID Me credentials. Some of you that may be veterans, I know a lot of veterans have those ID Me credentials. That allows you to set up a My Social Security account, or login.gov. Very simple, very simple and easy, so that we can authenticate, so that we can verify that it's you accessing this information. It used to be, before September 18th, it used to be you had to answer a few security questions. We called them out-of-wallet questions to verify your identity. But we found that some people had trouble. I mean, the questions sometimes were difficult. We weren't trying to make them difficult, but we were just trying to make it so that only you knew the answers to those questions, maybe not that fraudster that happened to have your name, a social security number, and date of birth. Again, it's all about protecting your information. We want to make sure that only you have access to this information. That's why we call it My Social Security. So remember now, when you're creating an account, it's through login.gov or ID Me. We don't have those security questions anymore. And if you receive benefits or if you're on Medicare, you have the option of opting out of mailed notices. If you rather receive them online, you have that option. You can replace your Social Security card, report wages. So if there are any folks listening to this, if you're on disability benefits and maybe you've tried to go back to work, in which case you would need to report those wages to Social Security. And instead of having to snail mail your pay stubs every month, you can just enter that information every month and it'll be electronically sent to us by going into your My Social Security account. Again, easy, it's a huge time saver, ensures that the person is receiving the correct amount of benefits. The most popular service through My Social Security that is used the most is the benefit verification letter service, right? Some of us that maybe live in public housing, or maybe some of us that receive fuel assistance and need to provide a proof of income letter or a benefit verification letter, and you used to call the office, you know, and ask for one to be mailed out, and you'd probably get it in about 10 days. Or maybe you'd go to the office, wait in line to pick one up. You can get one quickly if you log into your My Social Security account. You can print as many as you want, or you can even email a PDF of that letter to the requester. It's a huge time saver. It's a huge time saver. Again, simple things like changing your phone number or updating your address, switching your checks from one bank to another, right? Changing your direct deposit information. You can do that through your My Social Security account. We talked about the advanced designation of rep payees. That is also in your My Social Security portal. Replacing your Medicare card if you lost it, or it's time to file your income taxes and you lost the 1099 that we sent you, you can get a new one and print it at home through your My Social Security account. For folks that are not receiving benefits yet, they can use the benefit estimators. They can request a replacement Social Security card. They can and should look at their statement, review their earnings, make sure that everything there is correct. Okay. If they did file an application, they can check the status of that application. If it's been approved, if it was denied, if it's at a hearings office, they can check the status, see where that case is at. They can even, if they started an application and didn't get to finish it, they can go back and finish it through their My Social Security account. It's just a great, convenient way to do business with us. Another option, another safe and easy option, okay? Speaking of the statement, it's been redesigned recently to provide even more than just your earnings and benefit estimates. It now contains fact sheets that are age specific. So if I'm looking at my statement and I'm within a few years of attaining age 65, which is the Medicare age, right? Medicare eligibility age, it's going to contain fact sheets telling me about when I should enroll in Medicare. It's going to tell me about the initial enrollment period. It's going to tell me about the special enrollment period. If maybe I'm going to sign up for maybe just Part A and maybe defer Part B. It's going to talk about when I finally stop working, how to enroll during the special enrollment period. Talks about other savings options for folks that maybe are younger. Because again, Social Security was never meant to be anyone's sole source of income, right? It's supposed to be, just one level of that income, right? Hopefully you have pensions or savings or other streams of income, right? Because for most people, this is only 41% of your pre-retirement income, right? So our message is also about saving and planning, right? So we can have the retirement of our dreams. So the statements have been enhanced to include information to help people be better prepared to plan for their retirement. Okay, so this is what it looks like right now. Well, the front page of the statement provides benefit estimates at age 62, all the way up to age 70, which some people do that, right? So they can receive the absolute maximum amount from Social Security, so they can receive those delayed retirement credits, right? Shows them a summary of all of their earnings so that they can review it, because why? Because their benefit amount is based on those earnings, right? We look at a lifetime of earnings to calculate your benefit. And again, talks about important things to know about cost of living adjustments, disability benefits, spousal benefits, so much information, things that people are thinking about when they're getting ready to retire. Will my spouse qualify? Will my ex-spouse qualify? What about my children? We know people have those concerns. We know they have those questions. So we've enhanced the statement to include more information like that. Okay, so those fact sheets, again, very age related. They broke them down from for folks between 18 and 48, 49 to 60, 61 to 69, and then 70 plus. Again, more tools, especially the Medicare fact sheets, are very helpful. So people know when to enroll in Medicare, because some people that didn't receive that information or weren't aware sometimes don't sign up at the right time, and then they may face gaps or even penalties, right, for late filing. So again, just an example of what that fact sheet looks like for someone who's between the age of 49 and 60, right? Little information about choices they have to make, working while receiving benefits, right? If they're unable to work, maybe someone's thinking about retirement, but maybe they have a disability, so it even tells them about, well, maybe disability benefits might be an option for you. And it talks about benefits for family members like spouses, former spouses, children, disabled children, right? So again, how to open up that My Social Security account. Make sure you're on socialsecurity.gov. You can see right from the home page, you can click on the My Social Security icon to either sign in if you already have one or create an account, right? And remember, you're going to be brought into either login.gov or ID Me so that we can authenticate you. And then you'll be directed back into your My Social Security account so that you can use it however which way you want. Whether you're changing an address or whether you want to look at a statement, or maybe if you need a benefit verification. But remember, when you're first setting up the account for the first time, you're going to go into either login.gov or ID Me, right? So that we can authenticate you and get your credentials that way. Okay? You can also assist someone that may need help setting up their account, but of course they have to be with you. And they have to have their own email address, okay? And they have to answer those questions themselves, again, for security reasons, right? We don't want people having access to other people's Social Security benefit information. Okay? So we're also on social media, just like the kids, right? We're on Facebook, we're on Twitter, we're on YouTube, where sometimes you'll find helpful videos with information about updates. So yeah, if you asked me 20 years ago if we'd ever be on any of these platforms, I'd tell you, you're crazy. That's never going to happen. But yeah, Social Security is keeping up with the times because this is how people receive information. We know people are on their phones. We know people are on their tablets. People want access to information quickly. And social media is the best way for us to get those messages out. So if you're that person, if you're on Facebook or you're on Twitter, follow us, right? Follow us on whichever platform you're on or whichever one you use to receive your information so that you can receive the latest, most up-to-date information. All right. And with that, I'm going to thank you so much for your attention and for coming today.